I guess from a clinical perspective, I'll try not to repeat some of what we've already heard from the clinical side and talks of challenges, but look more towards solutions. We've certainly come a long way in the last 30 years in terms of the clinical management of HIV infection, and I have been privileged to have been there from the beginning of my career and in infectious disease. We certainly have learned a lot as a clinician, as opposed to some of my colleagues who have been engaged in other clinical endeavors. I think it was the advocacy, the community engagement that led to a lot of the advances that occurred in the clinical side of HIV infection. And I think we have to give a lot of credit to our community who has worked with us and the principles that they have worked with and tried to achieve these advances. When we look at the whole issue around program science, a lot of it is related to factors beyond the individual clinician and their patient. And I think some of our medical models are not well designed to provide that larger context. And so I think part of what needs to be done to move this forward from the individual clinician's point of view is some of our governing bodies, the CMA and the Ontario Medical Association, and hearing them provide some guidance and some promotion of these. You don't hear much from them, and when it comes to HIV anymore. Everybody thinks the problem has been licked from a clinical side point of view. But if one's looking at the prevention end, which we've been talking about the program science, is that if we don't provide patients with good care, once they're within the treatment cascade, that we are not going to prevent, if you use treatment as prevention as one of our means of slowing the spread, we have to make treatment a positive experience for patients. They cannot be stigmatized. They have to receive the resources that they need. And for many times, individual clinicians, I can write a prescription, but there's many factors for which the patient is not able to adhere or is not able to access the medication. And we really haven't done a good job, at least in this province of Ontario, of providing excellent access to medication. And so that when patients, we're going to prevent that they are adhering to the medication and therefore they do have undetectable viral loads. We also need to have ways that physicians can interact with community resources, be aware of community resources. We need physicians to come together and look at the science. We have to really look at our relationships with pharma and how they interact with physicians and community for sure as well. And we need better protocols, we need better dissemination of research results, we need better standards of care. And then we do need to evaluate the outcomes of our care. We really don't look at ourselves critically about quality and what kind of outcomes we actually have in our practices. What percent of our patients actually are undetectable? Those that aren't undetectable, why is that the case? What are the resources we need in order to do that? But the way our structures are set up clinically, that doesn't necessarily happen. We need to build capacity. We need more physicians who are willing to take this on. You have to remember that the clinicians who practice a lot of HIV medicine are a very dedicated group. They're a very passionate group. They are advocates for their patients, and they are self-selected in many ways. And we certainly need to support them and provide them the resources they need to continue in this work, or they will not. Just one other point about program science, just from a larger perspective, is that we're sort of looking at programs, we're looking at outcomes, we're looking at questions that we want to have to meet those objectives. And I think we can't take away from the fact that program science can't be the only route for a research agenda. Our science has to allow for that creativity and that academic freedom so that things may occur that will change the world, because we can't always know in advance what we necessarily need or want. And so we shouldn't constrain our funding to only those questions that we perceive are going to help an outcome that we want to get to, because it may be those things, as someone said before, out of the box that will move us forward. So I think those are a few of my comments in the short term.